Spice FM KE, Facebook, YouTube, and Twitter, as well as www.spicefm.co.ke. And right now, again, for the next 1 hour, we are also live on KTN Home. Let's talk about COVID-19 and hospitals. A story on page 5 of the Standard this morning. Hospitals told not to turn away patients. The government is directing hospitals not to turn away patients with COVID-19 symptoms. It's coming as the country recorded new cases of COVID-19. During the daily update yesterday, the Health Chief Administrative Secretary, Dr. Rashid Aman, said every facility should be ready to handle COVID-19 cases. Every facility should be ready to handle COVID-19 cases. This is what the government is saying, and is regretting that hospitals are turning away patients with COVID-19 symptoms. From where we sit as a ministry, this is likely like any other disease, and we'd like to fight any move that would lead to this disease being stigmatized. Aman is, however, saying due to unfamiliarity with the illness, some institutions might fear admitting such patients. Institutions must be prepared for the reality that we have, that community transmission of COVID-19 is here. This means that we will get people with symptoms, and we should treat them just like we will treat any other person who will come with any other disease at any other time. This goes with a story that's a headline of The Star, for example, this morning. I was dying with COVID. No hospital wanted me. It's telling the story of a gentleman called Robert Kariuki, who says around June 26th, it was a Friday, he was rained on while he was going home to Kiambu. On Monday, he felt very cold and also developed a small cough, took antibiotics, but the cough persisted. It was dry and irritating, and he felt like he was choking, right? Falling short of breath. This 36-year-old man went to hospital. He says he was not even used to allow the toilets of one facility. He was quickly ushered out of the gate, and he was struggled for 48 hours, begging different hospitals in Nairobi to admit him. 2 others rejected him, and time and breath were running out. Direct story of somebody who says, presented himself. He has, what does he say? He has medical insurance, which is to the tune of 500,000 shillings.
Mm-hmm.
But that was not the issue. He presented himself. He said, I have this dry cough. I'm running short of breath. He had a temperature of 38 degrees. That alone was, okay, no, sorry, we cannot admit you here. 48 hours trying to go to different facilities, was not admitted. This is not unique. We have heard other stories. We've seen other stories on social media where people are saying that they've gone to a hospital and they're told, you know what, you need 650,000 shillings deposit so we can admit you. Basically just putting up a barrier. So you cannot access our facility. What's happening?
Well, by the time you hear the CAS saying that that hospitals should be ready, then there's an intonation that hospitals are
clearly not
ready.
At what point were they ready?
Exactly. They were never ready. And for it to be said that now they should actually be ready, at what point is that going to be? And unfortunately, we're already at the place whereby who needs to tell you not to turn away a patient, first of all? Secondly, by the time the CAS is then saying should accept, do you think that statement alone is not going to have some kind of mind shift amongst medical facilities and say, okay, well, you know what? The Ministry of Health has said we should take them in. So from tomorrow, we are then going to take that in.
Yes.
We are going to change our complete and total mindset about this and then now start to accept them. Do you really think that is going to be the case?
And against the backdrop of hospitals and health facilities complaining that this same government has not provided them with adequate protective gear, has not provided them with adequate wherewithal to be able to manage these patients.
And that's, I think, where the crux of the matter is. Because if you're working at a health facility and you're the first person that a patient will walk to, and they're exhibiting these symptoms, and you're not dressed in PPE.
Exposed.
You're exposed. What's your first reaction as a human being?
Self-preservation.
Self-preservation. So we are seeing very many of these facilities, these institutions doing that. But the question also is, why are the managements of these facilities not giving PPEs to their workers? We can go and say,
have they received the PPEs to begin with?
If it's public hospital, we can say government. If it's private hospital, received from who? That's your job.
No, Eric. No. The issue surrounding PPEs what is in the public domain is monies that have been spent on PPEs. We've been
Said
told
to have been spent.
it's been documented as spent. That's what I'm saying. We have information that they have plans, okay, to distribute these things. As to whether these things have been distributed and the manner and the quantities that have been distributed, I am in the dark. If someone has more information about this, maybe they can provide me that information. But it is not just a gray area. It's oblique, it's opaque, it is misty, it is foggy. You cannot tell what is happening in that sphere. And this is against a backdrop of a situation where, even before COVID, we had problems with our hospitals providing basic medication. It's not being available. We had a problem with some institutions, health institutions, people going on strike for the same reasons. There is no indication that these problems were resolved. And remember, health is supposed to be a devolved what?
Function.
Precisely. So, if these things can be cleared, if I have an understanding that these things have been done, then we know where to continue the conversation from. Right now, I can only have a conversation about the vagueness with which I'm approaching this particular subject. Yes.
But then you want to ask yourself the question that this young gentleman, Robert Karaoke, as he gave his story, what if, God forbid, he had died and went around looking for facility that would take him? It's not a matter of, because look, he was very clear. It's not a matter that he did not have the money, right? He went about, could not find a place. What if he had died? Because then later it was found that he was COVID positive, right? What if he had died from these complications?
At that point, in those very early stages,
Yes.
when he was seeking admission and he wasn't getting any admission
Exactly.
into facilities.
Now, if he has reported this, your mind wants to go to the numbers of others who have gone through this very same situation or
Yep,
worse,
yep.
but then did not have the possibility of going to a media house or somebody interviewing them or asking them what exactly happened. How many more people are being turned away? How many more people who may have the wherewithal to go and get medical attention are not getting it for this very same reason? The truth is that people are afraid. We may want to think that medical or health workers are some kind of angelic being that have descended from heaven, but they're human beings as well. So the fear
Is real.
is real.
Let's
But
rope
is
in.
it justified when people go to look for health care and are not given?
Let's rope in somebody who's a player in this sector. And this is the CEO of the Nairobi Hospital, Dr. Allan Pamba, our friend. Good morning, Allan.
Morning, Eric. How are you?
We are fine so far.
Keep it that way.
We can't predict the next 10 minutes, but all right.
Safe to put it that way. So, Allan, you've heard what we have introduced as a topic for this hour. There are very many complaints in both public and private hospitals. We saw, for instance, the wife of the late Papa Shirandula and what she said during the funeral. It was public, it was broadcast, and we saw the reaction from your compatriots at the current hospital and what they were saying. But this story, plus very many other stories out here, are basically indicating that hospitals are scared of COVID-19. What's the true situation?
Eric, you make a good point, and I think it's in this very station I'd spoken earlier, and I'd mentioned that COVID is going to test the resilience of health systems across the world. And where we are right now in Kenya, we are seeing the beginnings of what looks like a surge. We did do a lot of things right at the beginning of the pandemic to allow hospitals to prepare and be ready for this. And I think the test is now. And we are seeing an increased number of people looking for COVID testing and an increased number of people testing positive for COVID. Thankfully, not all of them need to be in hospitals. But for those who do need to be in hospitals, the question is, do we have enough facility to take care of them?
Do we?
Well, I can only speak for the hospital that I run. And I think we've done as much as we can. I have no knowledge that as an institution we've turned away any COVID patients because we haven't had capacity to take care of them. We have come really close to that. I'll tell you that for a fact. 2 weeks ago, I was called on a Saturday, and we were down to our last 2 beds. And it's very scary when you get there. because you begin to worry, well, we might get to that stage where we're turning people away. Thankfully, we didn't, but we are running very close to capacity at the moment. Now, the first duty, going back to the point made earlier on, I think Oko made the point, of a hospital administrator is to keep your health workers safe. If you can't keep them safe, then you will quickly have no hospital, because the hospital is not the buildings. It's actually the people that run those facilities and the buildings. And so every administrator has to make sure that frontline health workers who will meet these patients have the PPE, the protective gear that they need. If you don't provide them that, it's only human and natural that they fear.
Right.
They're just as vulnerable as the rest of us to catch COVID. And so we have prioritized that in our hospital. And it's been a very difficult thing to do because, as we said in one of the previous programs, COVID is one disease whose supply chain has failed. You get a couple of monopolies running the supply of key equipment or gear that you need to take care of COVID patients, because they're in short supply globally. And so they're prohibitively expensive and sometimes not available at all. And when you tell, your receptionist at the front of the hospital or the doctors and nurses in the A&E department that, I'm sorry, you have no face shields, you have no N95 masks, you have no PPEs, but I still expect you to receive COVID patients coming to the hospital and take them to a ward bed. You can't do that. I do worry that some hospitals are in such a situation, and that's why you get dramatic situations where, patients coming in with COVID-like symptoms are not even allowed to use the toilet in the hospital and are literally probably chased away.
Yeah.
And we do get some of those referrals, where it's done decently. We get a phone call and we're told we've got somebody, we think they have COVID. Would you mind taking them? And a couple of times we've sent ambulances out to other hospitals to receive some of those patients, or they've been brought to us. Because as long as you have the capacity and the person is happy to come into your hospital, it's hard to turn them away. So this is testing the resilience of our health system.
As a private hospital, if I may ask, Dr. Pamba, how do you manage to ensure that you equip your health staff adequately to ensure that they are A, protected, and B, that you have sufficient equipment to deal with people who exhibit or people who come to the hospital with COVID complications?
Is that Charles?
Yes,
Yes.
it is.
It's quite challenging, Charles. It's not easy because we have to forecast very, carefully and purchase the required PPEs and other supplies in the highest volumes that we can get. In some instances, we succeed. In others, we don't succeed so well. But so far, we've been lucky that our forecasting has generally matched the number of cases that we've been handling and the requirements for our inpatients. It takes a lot of foresight on the part of the hospital administration to be able to predict this is how many PPEs I'm going to need or N95 masks I'm going to need over this period of time. And there may be no supply in 2 months' time, so let me buy for the next 4 months or 5 months. And be able to run my operations. It also takes a certain degree of financial muscle to be able to do that, which I appreciate not every hospital can do. So you'll get variable degrees of care or continuity of care across hospital, depending on how well they're forecast and to some extent the financial muscle that they can bring into this to buy these really expensive supplies at very high prices.
Allan, just looking at this now, just from what you've just said, to the general sentiments that may be out there, anybody then who does begin to notice symptoms, how then or what then would you say to people who have the fear or that they may go to hospital and then be rejected based on this, that we don't know if we have enough that could cater for everybody, then what does the general populace do?
Well, I think the first thing is listen to what the President and the Cabinet Secretary Health are saying. Take care of yourself. This thing is real, and we are all vulnerable.
Yeah.
And there's no telling whether I will need to go to hospital or not, just purely based on my age. Yes, it's true, younger people are less likely to develop severe symptoms. But we've seen everything from a 1-year-old to a 36-year-old to a 99-year-old coming to hospital and unfortunately sometimes succumbing to COVID.
Right.
So I think the first thing is we all need to be vigilant. Let's not lower our guard. Even when the government tries to release the lockdown to help the economy run, it doesn't mean that things are good and I can now take off my mask or stop social distancing and drink through the night. Doesn't mean that at all. We are still very vulnerable.
And we ought to take care.
We ought to take care.
There's something that you said, Allan, that when you look at hospitals, financial muscle of a hospital is critical at this particular point because you're dealing in challenging times in terms of procurement. So very many hospitals were already not doing so well before COVID. Then COVID came and numbers completely went to almost zero. And now they're trying to revive their businesses. So they really do not have that kind of cash to be able to operate and do these things. So what should they be doing? It's a reality. COVID is there. The second reality is that patients are likely to walk to those facilities exhibiting COVID-19 symptoms, others exhibiting other symptoms that are not for COVID-19 and seeking healthcare for other ailments.
You're right, Eric. It's very hard for hospitals because we've gone through a dip. Our revenues are rock bottom, and now we've gone through a dip in terms of revenues, and now we're getting a surge in terms of COVID, and expected to procure COVID supplies in large volumes at high prices, and hold capital in that way as we hopefully see patients and then recover the investment. Not many hospitals have access to cash in that way, or credit from banks and so on. We have appealed to government to support us so that any monies owing from insurance is paid. And, in some instances, we've had to take a very strong stance. And, because as a hospital, we recognize if we can't access what is owed, and we don't want to get to a borrowing situation when we have debt out there, then we're going to be turning away patients who need to be saved at this point in time in history. So we've taken a hard stance, and the insurance companies have supported us and continue to support us in terms of settling any previous debt as we go through this dip. There may be a role for government to also support some hospitals even more to ensure that they are well stocked with supplies that are required to take care of COVID patients.
Okay.
It's not enough to tell a hospital not to turn away a patient.
In a situation such as the one that we now have with COVID, Dr. Pamba, would it be unusual for the government to even assist private institutions like yours?
It wouldn't. It wouldn't at all, Charles, because there are instances where we have run out of PPEs, and I have personally appealed to the offices of Mutai Kagwe and said, look, we have a crisis. We have no PPEs. We are willing to pay for them. We've got patients coming through the door. And credit to them, a truck has arrived with PPEs, not too much, but enough to tide us to, when we can get the next supply. And we've been able to manage patients. And when our supplies came, we paid back whatever they had given us. I think government should take that approach. Beating COVID will require a really strong level of collaboration between hospitals, both private and public, and government.
We are speaking to Dr. Allan Pamba. He is the Chief Executive Officer of the Nairobi Hospital. We want to talk to him about, fighting COVID-19, and just picking up from that question that you've asked him, CT, about the public sector supporting the private sector, specifically on the fight against COVID. I think COVID, like Dr. Masi has said very many times before, COVID, it doesn't matter whether it's in public or private, should be government responsibility in terms of provision of PPEs, in terms of just coordinating the entire management of COVID-19. We'll ask you, Dr. Allan Pamba, your response to that as other questions also emerge. And also we'll be opening up some phone lines so that people can ask you some direct questions. At the same time, you'll tell us about this big deal that you've signed with the United Nations, where you have you are like going to be the hospital that treats UN patients for COVID-19. Broadcasting on Spice FM and KTN Home, we are asking ourselves the question, are hospitals scared of COVID-19? So let's take the facts as we speak to Dr. Allan Pamba, the CEO of the Nairobi Hospital. Fact is, we are at an increased level of community transmission of COVID-19. Second fact is that COVID-19 is now in almost all parts of the country, all counties of this country. The other fact is that private hospitals and public hospitals are receiving patients who are ending up testing positive for COVID-19 or even coming to hospital exhibiting symptoms of COVID-19. Fact, as we have seen the reports on media and social media, is that there are some private hospitals and public hospitals that are not able to deal with patients who are walking in with symptoms looking like COVID-19. And among the challenges that the hospitals are facing is that their staff are not really wearing PPEs because the hospitals have not provided their staff with PPEs. Dr. Allan Pamba has just told us they're operating in very tough times where the supply chain has, like he said, collapsed, the global supply chain. Access to these PPEs and other equipment is not easy. There are some people who have monopolized this trade. It's become completely expensive, getting out of reach of very many facilities and governments. So, fact of the matter is very many people are going to be turning into the nearest health facility to them, seeking treatment or seeking care. The other fact of the matter, as we know so far, is that there are very many facilities, especially the small private facilities. We think about the public hospitals, and Dr. Allan Pamba has already told us there are a few that are called the big private hospitals, and there are very many that are small private hospitals operating within the communities. Those ones will not be able to access these PPEs easily, readily, and as frequently as they should. So, the question that CT had asked you, Dr. Allan Pamba, is it possible for the government to work and support the private sector in fighting COVID-19? And I want to advance it to the next point and ask you, should COVID-19 not be a direct responsibility of the government, whether it's in private or in public hospitals?
Thank you, Eric, and thanks, City, for that question. COVID is a public health risk and also a risk to the economy. And to the extent that it poses a threat to the entire nation in that way, it becomes, you can classify it as a security risk.
It is.
And responsibility in that space falls heavily on a government in terms of giving very strong stewardship, in terms of directing resources to ensure that the situation is taken care of adequately. I think that responsibility of government is quite clear, and we can have a debate on to what extent have they embraced it. What is absolutely key is the need for collaboration across private, public sector, and all the players involved. To the extent that that can be galvanized, this country has enough resources within it to take care of COVID. To the extent that that's not galvanized, that collaboration and partnership and cooperation with government stewardship, if we fail to create that collaboration, then COVID will have a big impact on this country, both in terms of human lives, but also in terms of the economy.
Yeah.
Dr. Pamba, in addition to what you've said, we're not talking about the future. We're talking about a very present reality in terms of what is going on right now. And just as you've talked about, galvanizing support between private and public facilities, then I am sure you guys have the odd chat here and there. So you're quite aware of what's going on here. The numbers are rising. From all indications, they're going to continue to rise. If this is where we are, right now, then it looks pretty bleak for what would happen like I said, that is going to happen in the coming days and not even weeks. What then is necessary to be done now?
So I think you give me more credit than I deserve, Oko. There's probably conversations going on above me that I'm not
called you
aware
a prophet.
I will guess that at the level of the president and at that level of leadership, there's a reevaluation of our situation going on right now. Because even as they released some of the lockdown measures that we had earlier on, we saw an upsurge of numbers. And unfortunately, some of the headlines we've seen recently, including by leaders who should know better, are suggesting that the country has lowered its guard and might drive itself in the wrong direction. So I will not be surprised if the government comes back to us with more drastic measures to contain community transmission of this virus. Primarily because if you look at county level, yes, we pushed every county to have 300 beds, in terms of capacity and other things. But do they have everything that they will need if they did truly have a big surge within each county? And your guess to the answer to that question is as good as mine. So there is a nervousness there around our capacity, and there may be need to buy more time. And the way you buy time is you lock down and lock down hard and continue to get organized. We've seen this in South Africa.
Where they've gone back into a lockdown.
Yes.
So the other part of this fight against COVID is the stigmatization. And right at the beginning of the fight against COVID, there was what went into the public as fear for COVID, and also the belief that COVID came as a result of somebody's irresponsibility. The statements being made by senior government officials that, if you're arrested beyond curfew hours, then you're likely to have contracted COVID, so we're going to take you straight into quarantine or isolation until we test you. And the treatment of that, plus the fact that you had to pay for yourself quarantine and isolation. Now, let's come into this now where in private facilities, insurance is not catering for the treatment for COVID, so people have got to pay out of pocket. In public facilities, we are seeing that the number of hospital beds available are reducing, and that's why people are spending time crossing from one facility to another because they are looking for available bed space. That brings in the other issue of cost. How do we deal with this cost? Because cost is also likely to become a barrier for people seeking treatment for COVID.
It's a big and important question, Eric. Cost is a huge, huge barrier. It's very expensive to care for COVID. It's not your average cough and cold. When you come in to the hospital with COVID, literally everyone that attends you needs to have some kind of protective gear. And you end up paying for that. From the doctor who receives you in A&E, the nurse who cares for you, takes you to your hospital bed, and everyone who will care for you through your 14 or so days stay there, right down to the cleaner. They all have to be in PPEs. And this gear is super expensive, and patients get shocked when they get their bill after, recovering.
What's the average bill?
And
like at your facility?
I can't tell you off the top of my head.
Okay.
I'd have to check that, but I do know that it is expensive. And this takes me back to the message we had at the beginning. Prevention is so much better than cure here. People do get tired of social distancing, of wearing masks, of washing their hands and so on. Don't get tired now.
So
if
for
you
all
were to
avoidance
get
of
COVID,
doubt, and it seems that, unfortunately, some things have to be repetitive. So are we saying that the high numbers that we're seeing of people who are presenting themselves to hospital could actually be lower if individuals do what they need to do by protecting themselves?
correct, correct. There's a simple epidemiology principle. I'll be a little bit jargonistic here, but bear with me, called R0. So R0 is basically the number of cases you transmit COVID to when you get it. And if I get COVID now, if no one was taking care of anything, I'd probably transmit it to 8 people before I recovered, or 10 people. When you put in place all these interventions that we're doing, you reduce R0 to probably 4. So you slow the transmission.
Okay.
If you want to kill the transmission, R0 has to be 1 or less. So every one case transmits only to one other or to none.
Okay.
And then you really control. So everything we're doing is about reducing this R0 number. And if we were effective in reducing R0, then the hospitals see fewer cases. And it's just down to social distancing, hand washing, all those things that we already know.
Back to the issue of cost. How much lower would the cost come for you, for example, if the government worked with you, said the government is the one that's providing the PPEs for all your staff, and the government is, taking care of that side of treatment. So where you are also just charging the government for the basic bed and the basic food and the others that the other hospitality that you offer to a patient. I'm driving to the point here where I'm saying that somebody comes to the Nairobi hospital, someone goes to the Aga Khan, someone goes to Avenue, or whichever hospital, as long as they're undergoing treatment for COVID-19, it's a government cost. How much lower would it become?
I think we'd see it come down by about 80% or thereabouts. It's huge because a lot of the cost goes into your PPEs and those sorts of supplies that I talked about, which are very expensive now. And the wisdom in what you're suggesting, Eric, is it is possible, in my view, to come up with probably a standard COVID cost in every hospital that goes to the patient, and everything else the government takes care of. So that when you come, you know that this is what I'm going to pay because the government has paid for my PPEs, all my supplies, and so on in a particular facility. And of course, it would be a huge investment on the part of the government, but I think it's a worthwhile investment because, as we say, this is a national security issue.
Right. Was there a whiff of a suggestion in that direction at any one point in time?
Not that I've been aware of. Yeah.
Okay.
We're going to take some questions for you, Dr. Allan Pamba. 0719-012-600. Anybody, if you'd like to ask Dr. Allan Pamba, the Nairobi CEO, the Nairobi Hospital CEO, any questions?
Yeah, that's another CEO.
The Nairobi CEO Hospital.
I haven't qualified for that yet, Eric.
You haven't gotten there yet. So as we as we wait for the questions to come in, tell us about this 1 billion shilling COVID center that you're going to be building for the United Nations.
It's very opportune, Eric. I'm very excited about it. The whole
Of course,
thing.
you would be. It's 1 billion shillings.
Yeah.
I'd be excited about 1 billion shillings.
The whole thing was very opportune. So the UN have 20,000 staff and families based in Nairobi, equally impacted by COVID as we all are.
Yep.
Many of those are away from their original homes, on duty to serve humanity in different capacities. If you think about all the UN agencies we host in Nairobi. So they approached governments and they were concerned that if the patients or the subjects got COVID, they were not clear what the policies should be in terms of where they go. And the concern they had was they have a large population of people in our country, and they're acutely aware that our country has restrained capacity to take care of COVID.
Yep.
And in its wisdom, the government indicated that they should look at setting up a partnership where they will expand COVID care capacity. That way, if they needed to have UN subjects taken care of, it's not putting a strain on the capacity that Kenya has. So, reliably informed, they spoke to a number of potential partners, including us. And we were able to forge a win-win idea between us.
Mm-hmm.
And essentially, between us, what we're doing is we're putting a 150-bed COVID facility, complete with a theater, laboratory diagnostics, and what is called extracorporeal membrane oxygenation, ECMO, which is a very high
we
level.
know exactly what that is, Allan.
It's the first thing.
That sounds like $500 million shillings worth.
Yeah. I'm so proud of it. It's the first in the region. So it's also breaking technology barriers for us as a region, thanks to this partnership. It's a very high level of life support, that will now be unique to our facility. We're going to do this in 6 to 8 weeks. In 8 weeks' time, I'm hoping that we have patients in that facility. It's being built in our old nursing school. It's separate from the Nairobi hospital.
Okay.
I'm excited about that because COVID care will be completely separated from the hospital at that point in time, because we still continue to take care of our regular patients.
Mm-hmm. Are you going to be able to take care of other COVID patients? Let's call them the Kenyan COVID patients, not the UN
Of course we are. Of course, Eric, we are.
In
and
the
this
same
is
facility that
beauty
you're
of the
building?
partnership. Exactly the same facility. That facility is an extension of the Nairobi hospital. If you come to the Nairobi hospital requiring COVID care, that is where we will take you regardless of your nationality.
Okay.
The advantage for the UN is they have a designated facility where they don't need to think. They come straight there if they have patients who have COVID.
Taking questions for Dr. Allan Pamba, the Nairobi Hospital CEO, 0719-012-600. Also on social media, you can post your questions at SpiceFMKE, Facebook, and YouTube and Instagram, and Twitter as well. Frederick Olwet says the increase of healthcare workers getting COVID-19 is because of, one, the lack of proper training on handling a COVID patient, a lack of enough PPEs, and number three, fumigation of the machines and premises is wanting, considering there's outpatient services still on, of which there's no good planning. What do you say to that, Dr. Ari?
Good point. If you remember when COVID started, I'm being presumptive here, you may not remember, but I was new in this hospital. I was new in this hospital, and I took drastic measures to put in place protocols to protect health workers. I literally shut down the hospital. We stopped visitors coming to see patients. We shut down all our outpatient clinics, 6 of them, and we regrouped. And I got our infectious prevention control experts to advise us on the right protocols to prevent, first, the health workers from contracting COVID, and second, patients and anyone else coming into the facility. These protocols were put in place, rehearsed, and honed in, and then we reopened the hospital again. Unfortunately, at that point, we created so much fear in our regular patients, no one turned up. And it took a while before they built confidence that actually it's quite safe for me to walk the corridors of Nairobi Hospital. They've thought this through, I'm going to be fine. It also took a while for our frontline health workers to develop the confidence to manage COVID patients. We established an isolation ward within the hospital, which was ring-fenced completely from everything else, literally airlocked. And you will not see it and never see it unless you have COVID. And we have health workers and support staff, cleaners, people who bring food, etc., who had been trained to be able to get into this space and get out of it safely. They were very nervous at the beginning, but right now they are super confident, and it's so nice to see how, they care for our patients in that space. So that preparation is important.
Okay. David Neto says stigmatization is an issue, and it's really affecting patients, which is not a good thing. And this is basically going from the story that people are turning up at hospitals and being turned away. This entrenches stigmatization for COVID-19.
Yes, I agree, Eric. It's not ideal. What hospitals need to do is make sure that the front office staff, the first responders, the people at the front of the hospital who receive these patients, are well trained and are confident and feel safe. If they feel safe, they'll be confident, which means that they have PPEs, are protected, and so on, so that when that patient turns up, they are calm and they're able to explain to the patient the required protocols
Okay.
in a calm way.
Okay.
If they're not confident, they panic, and their reaction makes the patient panic and people around the patient panic. And there begins the stigma on subjects who either have COVID or might are suspected to have COVID.
Yeah.
Yeah.
So the issue of stigma, as we basically just go on with this, do you feel that the government is doing enough to fight stigma for COVID?
I think the government has had its hands full to try and prevent transmission, to try and equip hospitals, and keep the subject alive in our heads so that we don't lower our guard. And some things have gone well, others less well. The messaging around stigma might have been stronger or should have been stronger.
Yeah.
There may be a few more things that they could do. And I think it's playing out now that we've got community transmission and more people knowing someone who has COVID or being close physically, even in terms of a neighbor in an apartment block or an estate, to someone who is getting home-based care with COVID.
Yeah.
And so that messaging needs to be enhanced, even as they drove the home-based care approach.
Let's hear this question from Cyprian, who's calling in from Oyugis. Good morning, Cyprian.
Good morning to you.
You have a question for Dr. Allan Pamba.
Yes, I have a question for Dr. Allan.
Go ahead.
Yes, I'm asking if somebody is under comprehensive NHIF cover, can that be used to pay for COVID treatment in private hospitals and public hospitals?
It's a good question.
Now that he's saying that it is the treatment is expensive.
Yeah.
Yes.
Allan?
Cyprian, my answer to you is yes.
Yes.
But
yes,
I think that question needs to be appropriately answered by the CEO of NHIF. I give a view as a healthcare worker and also as a citizen of this country. I think we do owe our insured population some degree of responsibility in terms of taking care of them, especially now in this time of crisis. If the cover is not comprehensive in terms of the insurance comprehensively paying for COVID care, it should be very clear what percentage they'll cover up to. We are having some conversations with insurance companies, and I do understand where they're coming from. Care for COVID is hugely expensive and could be disruptive to that entire industry. So we are having conversations to understand how we can work together for the mutual benefit of our two respective industries, but primarily for the mutual benefit of our common customers. And hopefully those conversations progress faster and we are able to come up with...
Those conversations are taking too long, Dr. Allan. 3 months ago, we asked you this question. You said there are conversations.
I hear you. Yeah.
Insurance companies buying time. What is it? Are they stalling?
Hoping that COVID will disappear and then they don't have to have this conversation.
Yeah.
You know, that's it could be.
Yeah.
You know, because it's here. It's not. Doesn't seem to be going anywhere anytime quick.
You know, this situation that we're in, Dr. Pamba, can be equated to a state of war. So it's all hands on deck. Private entities that are known to focus on profit cannot focus on the same profits they've been making, because these profits are made off the back of the citizens of this country. Now, if they all die, there will be no profit to make.
Correct.
So it is in their interest to ensure that they play their part constructively in ensuring that the citizenry continue being well.
Correct.
Tell them we said that. Tell them City Muga. And the situation room says that. So, final minutes as we conclude our conversation with Dr. Allan Pamba, the CEO of the Nairobi Hospital. Well, he's just told us about this new deal that they've inked with the United Nations, where it's a partnership. It's going to be about 1 billion shillings. They're going to put up a new facility that will be now COVID specific at the old nursing institution, right?
Yep, correct.
Okay. So Back to the question of costs, back to the issue that you're saying you've been having conversations with the insurance companies, and CT has told you just take the challenge to them. Just tell them, come on, the way you're going to have customers is by ensuring that they stay alive
Yeah.
a bit longer.
No, CT is spot on. You know what I'd say to that? This is something, in my view, that could move so much faster if government stewardship came in, to drive it. Get us around the table, insurers, hospitals, government. Let's say this is a national crisis. We need to sort it out. We're facing a surge at the moment.
Yeah.
Cost is a barrier to many people. How do we resolve it? What can you take care of insurance? What can you take care of private hospitals? And what can the government take care of? Back to what you suggested earlier on, that there's a certain degree of responsibility for the government across all hospitals, public or private. And I think one of the things that has created an impasse between insurers and hospitals is insurers are, reasonably concerned that the cost of taking care of one COVID patient is so high. If they were to pay for all COVID patients, the premiums will not support it, and the industry would literally, come to its knees. Now, at the heart of that is the supply chain. Can we get the cost of these supplies down, or get the government to take that cost? And then the hospitals now literally just charge you for a bed and your doctor and nurse care. So there's a formula that can be reached that could make this a lot simpler. And the simpler we create, the simpler a formula we create, where, Eric, you're told if you ever got COVID, you need to have X shillings a day for 14 days. The rest is covered by government and your insurance. Then you relax.
True.
Hopefully don't lower your guard, but at least you feel comforted in a country where you are reasonably assured of your life if you got COVID.
Exactly.
Dr. Allan, looking at the suggestions that you've made, would it be totally debilitating to government if such a thing was put in place? Because we ask the question and we say, okay, this can be done, but are we building castles in the sky by even thinking that such a thing could happen? Or is it financially crippling on the part of government?
No, look, Oko, you saw what Equity Bank did the other day. Huge sums of money donated to
the
help this cause. Yeah, there are a lot of private sector institutions that care for the safety of their workers, who are the same citizens that get COVID. Funding can be galvanized. If we look organized, the World Bank, there are lots of funding avenues that can be tapped into. This country also loses a lot of money in ways that it shouldn't, if you think about it. So I don't think money
is the issue
necessarily the issue here. We can do this.
It seems to be a scapegoat, though, in very, very many cases, that because we don't have the money, therefore we cannot do this, we cannot provide. So the conversation then should be shifted away from this money, yes, and gone back to,
it's a basic responsibility.
It's a basic responsibility of government then in this case.
I think government can galvanize and drive and steward to a holistic solution that covers, as you suggested, public and private.
Dr. Allan Pamba, thank you very much for speaking to us this morning once again. Soon, when this COVID thing is over, or at least we have better ways of dealing with it, you will be sitting on the hot seat here so we can have this conversation face to face.
It will be a pleasure, guys.
Thank you so much.
Thank you.
Thank you very much, Dr.
Thank
Pamba.
you so much.